Thank you very much. I think as beneficial as the Pact Act will be, and with as much anticipation as was expected and difficult it was to pass, perhaps implementing it will be much more difficult than getting to this point. Having said that, as both a physician and a veteran, and have provided care within the community for veterans, I'm extremely concerned about some of the comments I've heard today, especially related to care in the community. So currently, regardless of what healthcare system one is in, whether it is federal or private or nonprofit, there is a shortage of physicians. There is a shortage, massive shortage of physicians, nurses, practitioners at all levels. So you've mentioned this in some ways, Dr. Elmenhall, about trying to remove hiring caps and wage caps. However, my concern is that when I talk to physicians within the community, and just had this experience last month, they find many obstacles and barriers and a dismissiveness to them in providing care to veterans. And I think, and even the comments I heard today were disparaging of those who provide care with. And so having provided care to veterans in our community under the Mission Act, I think what I'm asking you is, what's your perception and what message are you giving to those physicians who provide care in communities? Because quite honestly, there are not enough physicians or nurses to provide care within the VA system. You can't ramp up, you can't do loan repayment, you can't bring them in fast enough to service what is currently potentially 5 million veterans, and as said earlier, an increase of 55%.
So thank you for the question, Congresswoman. It was not my intention at all to undercut the importance of community care physicians. The fact is, a third of our workload and more than 25% of our outpatient appointments are provided by these essential physicians, which is why we have a robust community care network. I really view this year as an opportunity to make that network even more robust and add more providers to that list of folks seeing veterans. And so writ large, these are really important providers for us.
Thank you for that. And please make sure that all throughout, at all levels of the VA system, that is understood, and that these are valuable members providing care to our veterans. I also have concerns about how we will do this in an electronic way, also to gather the data and information to go from a presumption of toxic exposure causing a disease to actually have the scientific knowledge and wherewithal and research base that disease was actually caused. That's one of the things we'll do when we haven't been able to adequately implement and institute our electronic healthcare system. So we're implementing the Pact Act when we're still years and millions and billions of dollars down the road of instituting our electronic healthcare system. So how are you integrating both of those things at the same time?
It's a really apt question, Congresswoman, and one of my first trips after taking this position was to one of our sites using the Cerner system. And a shared decision between me, the program leaders of the EHR initiative, the deputy secretary, was that at current state, the system is simply not working as intended for the clinicians using it. And that's not excusable, which is why we extended the secretary's initially announced pause in July to be able to only redeploy at the very earliest next June. And we have been working feverishly. This is not a pause of work. This is a pause that allows us to do even more work to make that system better alongside Oracle Cerner, reconfigure it so that it's intuitive for our clinicians, and that is our intent. We should see
perhaps
this works.
My time's running out, so I apologize. So perhaps in bonuses we're giving for good work, maybe we need to have people share in the risk when work is not implemented in the way that it should be implemented. And then I just want to comment on Representative Sablan. When people are outside of CONUS, they're not outside of the United States, I think was his point. And we know that we have veterans in all 50 states and overseas. And I have many veterans who have complained to me about applying for VA benefits in the electronic system. It is not well designed, it is hard to navigate, and these are people who are not foreign to the internet. And so, Mr. Jacobs, what's the VA's plan to reach veterans who are overseas and make this process of applying electronically easier for veterans?
Yeah, thank you very much for the question. We have worked to redesign our online application effort on va.gov. We also partner, I know, with the embassies overseas to help connect information. If you have specific concerns or complaints that you're hearing from your constituents, I'd like to follow up and better understand that to make sure that the current efforts we have in place are actually meeting the concerns that you're hearing about. And so I'd love to follow up if possible.